So welcome and thank you, Toby, for a wonderful introduction, and thank you for CROSH for providing the opportunity for me to present on my research project that I've been working on. So the project is titled Harness Suspension, a Working at Heights Training Provider Organizational Analysis. So we'll start off just with some acknowledgements regarding this research project. We had two primary funders for the project, NSERC, which is the Natural Sciences and Engineering Research Council of Canada, and the Ministry of Labour, Training and Skills Development. So we also had some key contributors for this research project, Dr. Anil Adisesh, who's the head of Division of Occupational Medicine at St. Michael's Hospital. He's also Associate Professor and Division Director of Occupational Medicine at U of T. Dr. Adisesh is an expert in harness suspension and has published multiple research articles on the topic. Dr. Sandra Dorman, who's the director here at CROSH and also a full professor at Laurentian University. She was my supervisor for this research project. And without her support, this research project probably would have went off the rails. So a big thank you to Dr. Dorman for keeping it on track and being a great support to myself. Toby Mankus, who's our Master of Ceremonies today for CROSHCon, and the Science Communication Officer at CROSH. Toby's been a great support as we work on some knowledge transfer resources for the sector. Mr. Mike Steinman, who's a retired paramedic, but he's also the project founder. And without him, this project wouldn't exist. So a big thank you to Mr. Steinman. And I'll talk a little bit more about his impact on this research. And last, but certainly not least, all the Working at Heights training providers that participated in this research project. Without them, we wouldn't have the feedback to do an analysis. Their consultation and their expertise has been greatly appreciated. So we're going to do an introduction and look at a bit of a background information around this research project. So this project was founded by a local paramedic, Mr. Mike Steinman, who, when attending a Working at Heights training that discussed treatment and management, questioned the information being shared as it went against what he was taught as a paramedic around standard first aid and trauma management. As a result of Mr. Steinman's initial questioning and research, the project was brought forward to CROSH. Without Mr. Steinman, this project and subsequent research wouldn't exist. I've participated in this project since May 2020, having been introduced to the topic and have spent extensive time researching and consulting with experts in the field of harness suspension, including reaching out to 190 Working at Heights training providers in Ontario to get their feedback and expertise on this topic. In April 2015, the Ministry of Labour, Training, Skills and Development imposed mandatory Working at Heights training for all workers accessing Working at Heights. This resulted in an increase of workers using harnesses as a form of PPE. Workers that are working at heights in a harness are susceptible to suspension after a fall arrest, which has caused concern about harness suspension. Working at Heights training providers are required to educate trainees on what has been incorrectly termed suspension trauma, even though the research regarding the subject is inconsistent and does not accurately reflect what is happening physiologically to the fallen worker into harness. Making this research even more relevant is the fact that little is known about harness suspension, and even if it is occurring with workers that are working at heights. Misguided information about the treatment and management of a worker who has fallen into harness has led to more questions and little clarity about this topic, and explain why there has been, up to this point, no consensus on terminology or treatment and management of a harness suspension. That's why it is not surprising that Working at Heights training providers almost unanimously indicated that clear guidelines around the treatment and management of harness suspension are needed. With the increasing number of workers using harnesses, it is not a matter of if a harness suspension will occur, but when. It is critical that consistent, clear knowledge transfer occur about the topic of harness suspension and how to safely treat and manage a worker who has fallen suspended into harness. So just go over an overview over the presentation for today and what we're going to be covering. During this presentation, the topic of harness suspension will be explored and defined. Discussion of harness suspension incident rates will be covered, along with current treatment and management practices of Working at Heights training providers. Positioning of the worker post-fall and why it is so important, The topic of harness compliance and fit will be shared based on consultation from Working at Heights training providers. The presentation will be wrapped up by looking at some discussion points from this research and 5 key recommendations. So what is harness suspension? Well, it's 2 components or stages: harness suspension and suspension syncope. Harness suspension is when a worker falls from height into a harness. The worker is held motionless vertically, which leads to a physiological response in the body, even after just a short period of time. This can be as little as 10 minutes or less. This physiological state causes the development of pre-syncopal symptoms, such as dizziness and nauseousness, and can involve syncope or total loss of consciousness, which can be fatal. This is called orthostatic hypotension, but has been incorrectly termed suspension trauma in the broader community. Orthostatic hypotension is caused by pooling of the blood in the lower extremities due to the suspended worker being held motionless in their harness. Harness manufacturers, in response to concerns of potential harness suspension, develop trauma release straps that can be deployed after a worker has fallen into harness and is suspended motionless. The trauma release straps are designed to allow the suspended worker to pump their legs against the straps, activating muscles and circulation of blood back up through the rest of the body. In theory, these trauma release straps are great, especially if an immediate rescue cannot occur. The difficulty is that this device does nothing for the injured or unconscious worker, and why it should not replace a thorough rescue plan that can be activated quickly to remove the fallen worker from suspension. While researching the topic of harness suspension, it became abundantly clear that one of the major challenges is the use of terminology. Harness suspension has also been known to be called suspension trauma, harness hang syndrome, suspension syncope, among other names. This lack of clarity on terminology makes it increasingly difficult to locate accurate information about this topic and has led to more confusion and questions than answers. During an informal poll of paramedics and physicians, when asked if they heard of suspension trauma, the most common response was if I meant a person hanging from a noose. When I explained that it has been used to describe a worker suspended into harness, they seemed surprised and even shocked. A major part of this research involved an extensive literature review of the topic. In total, 64 papers were reviewed, with 30 papers meeting the criteria addressing incidence and occurrence of harness suspension, or an alternate name, treatment and management, and harness impact and design. The purpose of this project covered 3 important questions pertaining to harness suspension. First, to assess whether harness suspension events were occurring in the industrial sector, and if so, at what rate. To consult with Working at Heights training providers in Ontario and compare their training in regard to harness suspension management. And third, last, talk with Working at Heights training providers about harness equipment regarding the prevention of suspension syncope and worker compliance. After extensive review of the literature and consultation with Working at Heights training providers, 0 cases of so-called suspension trauma were confirmed. This was supported by research conducted in 2010 by Dr. Anil Adisesh and colleagues, and there's been no confirmed cases of suspension trauma in the industrial sector in over 40 years. We questioned the reporting protocol regarding this and whether workplaces are reporting all falls into harness, including near misses, even when a worker is not injured. I'll talk about this topic more in the discussion and recommendation sections of this presentation. Is harness suspension a real risk? This was a question asked of Working at Heights training providers. Even with 0 confirmed cases, 95% responded that yes, they believe harness suspension poses a real risk to workers. Next, we're going to talk about treatment and management. The only thing we could confirm regarding treatment and management of harness suspension is that there is no consensus among Working at Heights training providers. There was a 22% response rate among Working at Heights training providers for this project, with almost a 50-50 split regarding which providers provide treatment and management information in their training programs and those who do not. This information was obviously concerning. However, considering all the misinformation posted online, not at all surprising. Factor in false medical terminology such as reflow syndrome or rescue death, and how heavily cited this information has become, there's no wonder that Working at Heights training providers are confused and misguided. It justifies the almost unanimous response by training providers for clear treatment and management guidelines for harness suspension. The terms reflow syndrome and rescue death were anecdotal terms used by a group of rescue mountain doctors in the early 70s at a conference in Innsbruck, Austria. They felt that if a suspended person was laid in a horizontal position post-fall, they would suffer from a rush of acidic blood back to the heart, causing overstrain, being potentially fatal. There's no evidence supporting that rescue death or reflow syndrome exists. Yet the Health and Safety Executive Report in 2002 that published this is the most highly cited resource pertaining to suspension trauma or harness suspension. This report has since been retracted, and a new Health and Safety Executive Report has since been published by Dr. Neil Adisesh and colleagues with clear guidelines provided. This leads to the topic of positioning of a worker post-fall. 94% of working at heights training providers offer treatment and management recommendations around positioning the worker post-fall that do not align with consensus international recommendations for standard first aid management of a worker experiencing harness suspension and has suffered from pre-syncope or syncope. The consensus around positioning is that the worker be placed in a horizontal position to allow for recovery and blood flow to return to the brain. Any other position compromises the return of blood flow and can lead to further medical issues. Only 6% of the providers who participated in the project teach treatment and management that aligns with the international recommendations for positioning of a worker post-fall. The UK and Australia have led the way in developing a consensus treatment and management plan to support first responders when dealing with a person in harness suspension. It is crucial that North America follow suit and adopt these same guidelines based on best practice for treatment and management of a harness suspension in syncope. An interesting and unexpected part of this project was consideration of regional location of working at heights training providers and whether this had any influence on treatment and management plans of harness suspension. For this, 4 regions, North, East, Central, and West, were used to break down location of the providers that participated. Some points that jump out regarding this data is that there was a very low response rate from Northern working at heights training providers. Eastern and Central regions were consistent with overall response, with a close to 50-50 providing treatment and management of harness suspension and those that do not cover this in their training programs. The Western region data showed that 70% of the providers that responded offered treatment and management of harness suspension, which is well above the overall provincial average of about 50%. The take-home message we want to send to the industry is that harnesses save lives. That is a fact. It is important to also take into consideration factors for which workers are not using harnesses and thus not in compliance. There are a number of factors that working at heights training providers highlighted as to why workers may not be in compliance with harness use, including lack of education around the importance of harness use and that harnesses can be uncomfortable and even a hazard in some instances. Roofing contractors were identified by working at heights training providers as the least likely to comply with harness use. The most common reasoning for non-compliance, according to working at heights training providers, is that roofing contractors feel that harnesses are too bulky, uncomfortable, and actually can restrict movement. Tie-offs and anchors can also pose a risk as a tripping hazard. It is key for proper training and education on why harnesses are important. It is also equally important that harnesses properly fit workers to reduce discomfort and improve safety while working at heights. Role modeling for the next generation of workers is important. More emphasis needs to be placed on proper harness fit, which will hopefully in turn increase worker compliance with harness use. A shift in focus from a punitive, fine-based consequence to a more reward-based educational response to workers and employers is also crucial in creating change in worker compliance and reporting of falls from heights. So now we get to the discussion part of the research project. It is clear that modifications to the data collection process regarding falls from heights is required. Little is known about the incidence of harness suspension, and it would be meaningful to capture this data given the rise in use of harnesses in Ontario since 2015. There's legitimate concern for the current treatment and management of harness suspension by working at heights training providers, with little to no consistency from one provider to the next. Some providers are more comfortable discussing the topic and others openly avoid the topic of harness suspension and just cover what it is based on, is inaccurate, outdated information. One provider shared that they originally covered treatment and management of so-called suspension trauma, including positioning, based on information they obtained about the subject. However, They were questioned by participants about this information and then removed that portion of the training. If clear guidelines were provided, it would remove the guesswork from working at heights training providers and allow them to use up-to-date best practice around the treatment and management of harness suspension. Harness compliance is an issue related to many factors, including most notably harness fit and design. The terminology around so-called suspension trauma needs to change to more accurately reflect the physiological state of the worker who has fallen into harness. This change in terminology may not be easy or well received as the sector is used to the term suspension trauma. Consistent communication with working at heights training providers is important for this terminology shift to be accepted and implemented. So there was 5 key recommendations from this research project that came about. The first was that the Ministry of Labor Training, Skills and Development adopt clear guidelines around treatment and management of harness suspension and suspension syncope. That the Ministry of Labor Training, Skills and Development only approve working at heights training providers that are using the current best practice recommendations around the treatment and management of harness suspension and suspension syncope. The third recommendation was that the WSIB and workplaces collect specific fall into harness data to better understand this phenomenon. The fourth recommendation was that further research is warranted in harness fit and design. And the last recommendation was consideration regarding terminology to a better align with the physiological response to the body. And that is the presentation for today. We have references and contact. And thank you so much for listening today.
Thank you very much for sharing that with us today, George. So now, welcome questions from the audience. We have a couple minutes, so please throw them in the Q&A if you've got any questions. We do have one coming in now. So George, do you know of any other provinces that may have similar legislation or how it compares to different provinces?
I don't. Actually, really good question, Toby. I don't. I focused on Ontario provincially. That was the focus of this research project. But it would definitely be fascinating to do a little bit more research and look at across nationally what some of the other recommendations and training, mandatory training protocols are.
Gotcha. That makes sense. Okay, so if we don't have any other questions, that's okay. If you come up with them later, feel free to throw them in the actual chat addressed to George, and he'll be happy to answer them. And actually, let's see if we've got time here. So real quickly, George, where can we find information for treatment for workers in Ontario, like existing kind of locations?
Yeah, so we just did a publication that has been shared with the Ministry of Labor Training, Skills and Development. So we're hoping that that's going to be shared for everyone. Part of this research project in consulting with the working at heights training providers is that knowledge transfer and education be shared with them. So once all that information is confirmed, it will all be shared so everyone will have access to it.
Perfect. Thanks, George. And just a quick follow-up with that. So I guess the next step is the actual recommendations being sent to the MOL, but has that been done yet, or is that's coming in the future?
Yeah, that's happened through Dr. Dorman. There's been that discussion that's already occurred. So we're going to have some, there will be some further communication that'll be happening in that regard.